Hello, everyone. Good evening, and welcome to the Community Connect closing session. After a long and busy week, we come to the end of the conference, and sadly, also Community Connect, where we have been, talking to each other, mingling with each other. Community was coming together. My name is Jahidul Islam, and I'm one of the Union Community Advisory Panel, which is UCAP. And UCAP is part of Union. UCAP supports the organization of Community Connect session usually. So we are going to actually go on describing a little bit of this through a presentation. Yeah. So UCAP was actually initially, Ingrid, maybe the slide previous one, please. Yeah, thank you. So the UCAP was formed with the need for meaningfully engaging civil society and effective communities in all aspects of the union's activities. So because, whatever we do, union does as an organization, there is community voice is also needed. So that's why UCAP was developed. Next. So what as a UCAP, what our, UCAP is doing or what it's supposed to do. So UCAP actually prioritizes community issues. I mean, bring the community issues to the union. So it can be a conference, whatever the topics that conference should be focusing on, especially taking the view of the communities and how community can engage in the researches, a strategic plan and programming so that UCAP taking community voices can provide the input. And at the same time, UCAP also act as an ambassador to the union within local and global communities. Advise on community-based strategies so that, whatever strategies happen, UCAP has a role to actually consult with the communities before providing this advice to union. And also promote and nurture a strong relationship between the community as well as the union so that, the aim of this UCAP is to kind of bring the community issues to the union so that we have a synergy on what community needs and what union is actually developing in terms of their work within the TB. So thank you. I'll pass it on to Ingrid now. Thanks.
Thank you, Zaidu. Hi, everyone. My name is Ingrid Skuman from TV Proof. I'm the chairperson of UCAP. I'm on the union board representing civil society. And UCAP, as you know, and as all of you are, we are so passionate about Community Connect. I feel inspired when I look at these photos, just showing how far we've come with communities co-leading the union's work. And as you can see in the new Union TB strategy, community engagement is also at the heart of the union's response to TB. Community Connect is now integral part of the conference where we strengthen relationships with other advocates and we present research to learn so that we can use it as advocacy tools. So thank you for each person that's been involved with the Union Community Connect every year. We've become friends and it's just been really a privilege and we can't wait for next year to have a vibrant event that's super engaging in person. We want to say a thank you to our track leads. You've done an amazing job. So we had GCTA leading track 1, Community Rights, Gender and Stigma, Afro Global Alliance, who led COVID-19 lessons learned to strengthen the TB response, Frontline 8 and Alliance for Public Health, who led track 3, Political Environments for Community-Led Advocacy and Accountability, and Africa Coalition on TB, who led Driving Innovation and Equitable Access to New Tools, which was track 4. The sessions were so packed. It's been incredible to see. So people's capacity to watch and participate online is obviously higher than we almost anticipated. And it just shows your commitment and interest and passion to care for communities as well. So thank you for your time this week. And thank you to CCA for the opening ceremony video. And I just want to take a moment, Madhava, you should actually put your camera on So he's the behind the scenes program organizer that's been emailing all of us, making sure that our recordings are of the highest quality. And the program has been so engaging with new things like the live panel discussions. Like we had Copto, the union's TB director, presenting at Community Connect. So we're trying to bring in more and more scientific presenters to the Community Connect side and the creative session. So thank you, Madam, for your initiative. Then lastly, big thanks to our UCAT members, Albertina, Audie, Ria, Zaid, and Ashut. It's been a pleasure working together and learning from each other. So thank you for that. And then, yeah, I feel a bit sad to say goodbye as well, but it's really been a privilege to work with everyone. So the 6-year terms are ending. You can see Peter Owiti on screen with Wim van der Velde and ASIO, you all know, representing different regions. And we've really enjoyed serving on the UCAP and really look forward to what the new UCAP is going to do and to bring fresh ideas and innovation and energy to the union. So on that note, a massive congratulations to the new UCAP. So we are announcing you tonight and we are really proud and thank you for your willingness to serve. So we've got Pumeza Tesfaye, Dr. Ayaz Akhtar and Herman Varela from affected communities. Then we've got Tariro from Africa, Eva from Asia Pacific region, Zaidu from Europe, Kins ul Iman from Middle East, and Priya from the Southeast Asia region. Latin America and North America will still be advertised again to get participants so that we make sure we've got affected communities as well as the regions well represented. Thank you for your time and congrats to the new UCAT.
Thank you, Ingrid, for really good summary and introduction of old and new members of UCAP. So now I would like to actually introduce to Guy Marks, President and CEO of the union, for a short speech. Please, Guy.
Thank you very much, Zaidul, and thank you, Ingrid. First of all, I'd just like to say congratulations to UCAP and to all of the people that have been responsible, both individuals and organisations that have been responsible for putting together this UCAP program over the last few days. I wanted to particularly thank Ingrid and whom I know well, and other members of UCAP whom I know less well, but I know that some of you have been in UCAP for a long time and and some of you are finishing your tenure there. And I just wanted to thank you for the change, essentially, that I think you've been largely responsible for in the relationship between the union and civil society and affected communities and patients over the last 5 or 6 years. There was a time not that long ago when things were not that bright and there was quite a lot of conflict and and I think the work that's been done by your group in particular has led to a realization of the real alignment that there is between the interests of the union and the interests of affected communities. This was always the case, but was not particularly well understood, I think. And I think we now understand each other much better. There's a strong alignment between the various different sectors that are represented within the union. It's a very diverse organization that includes people for all sorts of people who are engaged in tuberculosis and lung health work. And a very important part of that community are patients, affected communities and individuals. who who are part of the coalition that is about ending suffering due to tuberculosis and lung disease. And that is our mission. We can't do it without all of us pulling in the same direction. And I believe we are now all pulling in the same direction. And I just wanted to take the opportunity to thank you for your contribution to that, and look forward to it continuing in the future. As I said, our vision as an organisation is ending suffering due to tuberculosis and lung disease, and I personally take that vision very seriously, and I think many members of the union do. I think it is time for us to work out what we need to do differently in relation. Let's start with TB. In relation to TB, what do we need to do differently to actually realise that vision? It's all very well to have a view about what we want to achieve, but you have to have a strategy to get there. Okay, and you either believe in it or you don't. I personally believe it is possible to end suffering due to tuberculosis, at least. And I think we need to get there, and I think we need the support of communities to help us to get there. But we're not going to get there by sort of treating one patient at a time. It's not a one patient at a time issue. It's about communities. It's about public health. We have to take a sort of public health, population-wide approach to solving this problem. And in relation to TB, it's about people demanding that they not be exposed to and infected with tuberculosis. Okay, if you live in my country, you have a right. We all know we have a right not to be infected with tuberculosis, and everybody demands that of government, that you not allow me or my family to be infected with tuberculosis. We need people in all countries around the world to demand that of their governments as well. That the reason people get tuberculosis is that they're exposed to somebody else who has tuberculosis and they're infected. And we need to raise the temperature, if you like, on that demand. The demand that we not only find people with tuberculosis for their own benefit, but for the benefit of the whole community. That finding and treating everybody with tuberculosis in the community, whether they know they have TB or not, whether they feel sick or not, is not only of interest to the people who are found, but to the people who are protected from getting TB. And I feel strongly that we need to shift the needle on what people are demanding in relation to TB prevention. That they have the right to be prevented from being infected. So that's what I'll be looking for over the next few years, is how we can motivate that agenda. And I'm hoping that I can count on support from communities and from UCAP to try and drive that agenda over the next few years. But I'll finish there. I won't prattle on for too much longer. There are of course a lot of other lung health problems that are important that we focus on. We need to focus on making sure that people have clean air to breathe, that they're not living in heavily polluted cities and buildings and homes, and that the air that they're breathing is not harmful to their health. We need to make sure that they're not being sold nicotine and tobacco containing products that are damaging to their health simply to make profits for people. And we need to make sure that people with chronic lung disease, asthma in particular, have access to treatments that save their lives. All of those part of our agenda as an organisation that's looking to end suffering due to tuberculosis and lung disease. And we're looking for community and affected communities to support us with that agenda as well on behalf of many people suffering from lung disease. So yeah, I will finish, and I will thank you once again. Thank you not only for this, the work that you've done in putting on this Community Connect program at this conference, which I understand has been an outstanding success, but also for the ongoing work that you're doing in bringing a community perspective to the work that's done by the union. So thanks very much, and back to you, Zahidul.
Thank you, Guy. I just also wanted to say thank you for being such a bold leader. I've had the opportunity to work quite closely with you the last while, and I think your leadership style is also something that we often in the work that we do as civil societies, we also want to get people's input to inform strategies. And it's just encouraging to see at a high level that the union is not a top-down approach, but that things like the strategy or how programs should be running, there's feedback and communication with affected communities. So it's a value that you are building more and more in the programs. And I think we can all learn from that type of leadership style as well. So thank you very much for being the president of the union. And then over to our track meet, and Peter, Wim, and Zahidul, if you can share some highlights. We'd also love to hear from people in the chat what stood out from the different tracks to you guys. Thanks.
Maybe Wim, go ahead. Yeah. Oh, Peter. Anyway.
Yeah, I would like to thank all of us. We have worked hard and we have come a long way. And we have had some progress right from when Mark took over from Dr. Chakaya to head this conference and the union. And we, as communities, as Mark had said, we had some slight issues that wasn't understandable. And also we had a time when there was no funding and then we had COVID, but we had all carried this together, worked around it, and now we are proud that we are able to have such a conference that is so successful, that involved the very people who are really affected by TB. And this is a great moment for us. And thank you, Guy, for supporting us. Thank you, Ingrid. And we welcome the new members who are joining the team, that please keep up the momentum. And I am convinced, like Guy had said, that we can end TB together. Thank you.
Wim, please.
If I may, I was going to highlight the sessions that we organized in the Community Connect on the track 4, which was access and innovation, student innovation. And we had just this afternoon 2 panels, or was part 1 and part 2, where we had the researchers discussing and sharing with communities about the new data that had come out and that was presented during the conference, and specifically on the shorter regimens for both drug sensitive and both drug resistant TB. And yeah, we had there's been a couple of phase 3 trials that have recently been published, some this week only, and the researchers and the scientists of these studies were trying to bring discuss these important results with the community members who were attending. So that was really the highlight, where you could, I mean, because the results were not all 100% positive. The fact that injectables did quite well is something that we as a community, I think, have to think twice what to do about that. The human right of having access, the human rights to the best possible treatment with the least side effects is something we have to think about as well. But that was really a good discussion that we had today, and also I believe it was yesterday or 2 days ago, when we had the different stakeholders. We had the policy makers, we had WHO, and of course community respondents as well, discussing about these new data, what it means for treatment and prevention in the coming years. So yeah, those were the highlights that I remember from this conference. And also I'd like just take the opportunity to say that it was a pleasure to serve on the UCAP since its inception. So it's time that, you know, I move on. Definitely. Like I said, I remember the days when there was no Community Connect, when there was no UCAP, when it was very difficult to have the community voices being heard in a very scientific conference. Yeah, and so those days are long ago. Well, not that long ago, but definitely everything has changed in the union thanks to the leadership of the union, who have heard our voices and have understood why it is important to listen to affected communities when they talk about diseases that involve them. So I'm very confident that the new team will make the community voices even more stronger, and I'm looking forward to working in other capacities with to make this happen. So I'm not gone yet, but good luck to the new team. Over.
Yeah. Thank you, Wim. I think we are running out of time, so I will just maybe share one or two from the track 3, which was actually political environments for community-led advocacy and accountability. So I think we had a couple of good sessions. For example, one was, I think, Ingrid, what you're mentioning about the TPT, and also what Wim just mentioned. I think there are lots of policies and guidelines, including the shorter regimen. I think the resonance was, even though we have guidelines, but they don't get implemented in the country, you know, so easily. So it takes a lot of time from guidelines to implementation. That is one of the barriers in terms of access to treatment and actually rolling out the new policies and guidelines. And another actually issue which was resonated also throughout many sessions is about, if we want to end TB, there is multi-sectoral accountability as well as multi-sectoral engagement. Maybe looking at only health sector may not be able to, you know, end TB. So we need to reach out to, you know, the multi-sectoral stakeholders in the country and globally. So that is another thing. Actually, many sessions have come up with, you know, that kind of a need for multi-sectoral engagement. And another third thing is about the vaccines. I think, you know, 2030 is, you know, just looming above us quite heavily. You know, we can see 2030 very clearly. But in order to achieve that, we need some more tools, which everyone thought maybe if an effective and, you know, vaccines would be available within some period of time, that might be helpful to achieve that target. So these are few, I think, key highlights from the sessions. And another issue, I think, it's, you know, that we need to position ourselves as a TB community for the UNHLM. There was a number of sessions on UNHLM, so that there are right messages actually delivered at the UNHLM, and there is governments are committing to what they say, and also they're accountable to what they commit. So these are, I think, a couple of those issues came up from throughout the sessions. So I just want to say also thank you to all of you being sort of, you know, pillar of the UCAP in the past. And of course, even though I will continue, I think we will be definitely drawing your experience and knowledge whenever is needed in any form that we can. So thank you for being in the UCAP, Ingrid, Peter, and Wim. And Guy, thank you as well for support. So
Great. Thanks for everyone who joined tonight as well. And we are happy to be so involved and hope to see each other quite soon for the next conference.
Okay.
Bye-bye, everybody.
Thank you and bye.
Bye-bye. Thank you, Zaidu.